Welcome to Monmouth in Focus, the show that really is probably our main focus to be able to get the word out on some of the great things Monmouth County is doing and bringing in different organizations, not just government organizations, but outside entities that make the success here of Monmouth County. And today I'm fortunate enough to have one of our biggest partners here in probably many years because of being in this pandemic to get us through this very difficult time. And I have both of them here. And I have from RJ Barnabas, I have Eric Carney, and I also have David Stout from our Brookdale Community College. So I want to talk a little bit about our partnership because I think I probably have to say it's probably the number one partnership, and I could tell you this, and by all means, the partnership, the only thing that we hear back is great feedback. So Eric, I want to maybe if I could start it off with you and you could kick off how this all unveiled and where we're at, and then I'll let Dave, if you could speak a little bit about the Brookdale input and part of this.
Absolutely, thank you so much, Director. As we all experienced it, we were all part of it. It was really organic. We at Monmouth Medical Center, we started providing vaccine to the community in late December. The county was doing so as well. I think we both realized at that point, really, for us to get the vaccine into the community at the scale that we would want to, that we were going to need to do it together. And so a couple calls back and forth, and we connected with President Stout, and it was almost like it was like the perfect partnership. All three came together to really just start developing the plans to get the clinic open. Within 2 weeks, the teams were working together with the mindset of whatever we need to do to get this site live and operational. We were committed to do so, and it was an unbelievable team effort, but does not happen without you, Director, clearly President Stout, without you, and without Terry O'Connor, our county administrator. So just a great example of what can happen when we all come together.
Thanks, Eric. Dave, like always, I think you and I have been on numerous chats here together, and you've always been such a great partner here, but this was just another example of you and your staff coming together. So how did it work internally inside the college?
Thanks, Director. And I wanted to reiterate what Eric just said. It was teamwork is really what brought this all together. So getting a phone call from you and saying, I have this great idea. We have a partner, and then almost immediately got a phone call from Eric saying we have this idea and we have a great partner in the county. It really was just beautiful how it all came together and everybody saw the vision. Once we received that phone call, we identified the spot in our auxiliary gym, our Brookdale Recreation Center, and we put the right team in place who would be working administratively with the county and also with RWJ Barnabas, and really meeting every single day to talk through the logistics of how this was all going to work. So we found the space, we worked out the logistics, and we were committed to working together as a team. Couldn't state it more simply than that.
Thank you. That's great. So, there was two types of medical teams. Obviously, the Monmouth Medical team has been doing a great job. And really, how was that coordinated to be so successful, Eric? Because I gotta believe, or correct me if I'm wrong, this is something that we do pretty regularly, even in your world, coming outside the campus that you are in Long Branch and your other campuses, but coming out to another outside entity and putting it together so well. Your staff has done a great job.
Mm-hmm. Well, thank you so much for that, Director. From our standpoint, I think that when the team first met together, there were a lot of unknowns, but we wanted to make sure safety was core of what we were doing. So we started, as we would normally do anything, we started with our team of experts. We had experts from the county, we had experts from the hospital. We had, as I said earlier, we've been doing this for several weeks now, so we've really had a lot of learned experience. We brought in experts from the county from the college on operations, and we started to develop our systems and our processes. The storage requirements, the preparation of this vaccine is really complex. So what I love about what our teams did is they put together a really innovative way for us to be able to make sure we have the vaccine, it's stored appropriately, it's stored safely, it's prepared the right way, and then ultimately it's provided by our team of clinical experts that we have from not only the county, from the hospital, and our just core volunteers that have been amazing helping us get this together.
Thank you.
And we've, and I think it's important to note that when you think about bringing a large group of people together like this, there's a lot of concerns about the spread of COVID-19. What I love about our team is they really took a proactive approach to just making sure we're doing the basics to keep everybody safe and to not, complicate this matter by even the situation by even spreading the virus further. So it's been just a great focus on safety. And really just prioritizing what we have at the heart of our culture, which is just keeping people well and healthy.
Thank you. And Dave, I know that we were very fortunate because of the great student base that we have there, particularly in nursing, that you were able to utilize some of that to our benefit here.
Yeah, that's true. As you know, Director, we have one of the best nursing programs in the state. And I always brag we have one of the best nursing programs in the country. We had a little bit of a lack of clarity in terms of whether we would be able to use the nursing students and at what level they would have to be in order for them to get some experience working as vaccinators. And so we finally got guidance on that. And then we had clinical instructors who were willing to dedicate the vaccination site as a place where the nursing students could get direct experience, and they could use it as a clinical experience for them. So it's been really wonderful for the students who've had that opportunity, not only to see the vaccination site in operation and to be part of the solution, but also to get direct experience in working in the vaccination site. And as you said before, we have so many incredible volunteers. So we have people from around the college and from the community who are coming in to volunteer.
So that's great. So, but there is still a lot of obstacles that we have to go through. Obviously, this site has to go by appointment only. And people have to realize we've launched out another new online scheduling system, which is available at visitmonmouth.com/health. Because of the limited number of vaccines, we have to go through this process here. Believe me, and I know that Eric and Dave both welcome this, that we are advocating, myself and the rest of the commissioners are advocating very hard to try to increase that distribution. And I've been a big advocate there by the distribution should be very clearly presented by population. And we are the 5th largest county in the state of New Jersey, and a credit that they have increased that. And there are other entities that are doing and providing this, but I have to end this and say to Eric and Dave, if it wasn't for your two partnerships, okay, there's not many things that, or times that my email goes off pretty regularly from constituents that are only all positive. And I have to say, every person that leaves Brookdale and the process between both of you, the operations, and then of course, providing the vaccines, I haven't heard one negative thing there. And we've given out a lot of shots there. So this is a true public-private partnership. And I think it's the model through the state of New Jersey. And I want to thank Terry O'Connor. I want to thank my staff. And more importantly, I want to thank both of your staff, because if it wasn't for you, you guys really made us look good here. And I can't thank you enough. And hopefully we'll be able to just continue to go. This is going to be a period of time. And we're looking forward to continuing this great partnership with both of you. So I want to thank each and every one of you, and looking forward to seeing you on site there.
Thank you.
Thank you both as well.
Thank you.